Welcome to GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis.
Sarcoma. Think A to G. Our specialist is Mr. Amit Kumar, consultant orthopaedic surgeon. A. Age.
It's almost like a triple hump, really, in the very young, and then you have the young adults and then the elderly. So, for example, the chondrosarcomas we see more in the older age group, whereas more of the Ewings in the younger children, and then young adults, you're looking at more of the osteosarcomas. So that's the thing. I mean, we do have a varying age group, and certainly, like soft tissue sarcomas, they can occur in any age group as well. But certainly, there's no particular age group. It is across any age.
B. Bone.
So bone sarcomas usually present with unexplained pain in a long bone, but it can happen in any bone. Usually patients will present with a bony swelling or an unexplained, sort of lump or swelling near the joint. It can occur in any age group, so you have to be mindful. It could be in the young and the young adults, but particularly the elderly as well. And they may complain of night pain. And usually what we do see is that when patients have had some sort of trauma to the area, they have an X-ray which shows an incidental finding of a bone lesion. So it is a very vague and broad specific presentations. I think certainly in the young adult group and children group, the most commonest areas we see is at the sort of end of the sort of long bones, so predominantly around the knee area. Which is where our growth plates are, which is where they're all growing. But if they have a swelling there or a lump or sort of pain in that area, it's something to be taken seriously. So X-ray is particularly useful for suspected bone sarcomas. We ourselves, we will follow it through with MRI scan with contrast for tumour protocols. We would obviously get a CT scan as well, and on occasion a PET scan and a bone scan, but they're more specialised investigations depending on the actual bone sarcoma itself. But essentially X-ray is your mainstay.
C. Check lumps.
99% of lumps are benign, but the lumps of concern are going to be lumps which are increasing in size. So you may have heard of the golf ball project by Sarcoma UK. So if they're approaching the size of a golf ball and the patient says it's getting bigger, and in Manchester we do see lumps at the size of mangoes or rugby balls, unfortunately, then that's something we need to take seriously. Particularly if it's sort of not superficial, is that if it's not very squashy and squidgy and it's not very mobile, such as a lipoma or a ganglion cyst, then that's something to take seriously.
D. Don't forget GIST.
Essentially a sarcoma of anywhere of the GI tract, commonly from the esophagus down. And, we have very specialised surgeons who deal with this. So in Manchester, we have the retroperitoneal team, who are a group of urologists and surgeons who help us deal with this. And it's usually found as an incidental finding. B symptoms, constitutional symptoms, weight loss. Again, you will go down the change of bowel habit pathway, which we should do. But, certainly if they're complaining of other vague symptoms, then, we would scan the abdomen and that's where we would see it.
E. Examination.
I think, certainly you have to examine the patient, and certainly with access now, in the advent of rapid diagnostic centres, our X-rays and ultrasound provisions, get to simple basic investigation. The orthopaedic unit of time is 4 to 6 weeks, and we can certainly safely advise a lot of patients that a lot of soft tissue injuries, sprains and twists will settle down after 4 to 6 weeks. And if, for example, a knee twist, you think it's a meniscal, you will refer either to the acute knee clinic, or they'll come through emergency to go into our acute knee clinic. Or certainly, you will get an MRI scan. So there are, things that we do have access to. And if you're finding that they're coming back up to 6 to 8 weeks, obviously don't think that it's, sarcoma at the top of the agenda, at the top of your differential, because it's very rare. But, if a patient doesn't really fit, any particular, then just think at the back of your head, well, is this cancer? I need to get a scan.
F. Family history.
There are some sort of genetic links, and with the whole genomic sequencing and the drive with the 100K Genome Project, we are getting more sort of specimens, and that's going to be in the next 10 to 20 years where we'll be able to pinpoint, certain associations.
G. Greater Manchester referral pro forma.
Every sort of region has a suspected cancer 2-week wait HSC 205 form. So find that, fill in the criteria. Please give a clinical history. I think the clinical history is more important than the criteria, I feel. And essentially, if you can attach any scan findings or tell us what you've done, then certainly we can assess it, and then we can action it from there on a 2-week wait.
Think A to G. A. Age. B. Bone. C. Check lumps.
D. Don't forget GIST.
E. Examination.
F. Family history.
G. Greater Manchester Referral Proforma.
GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis.